Iron deficiency is one of the most common nutritional deficiencies in the world, and yet it's also one of the most misunderstood. Many people are told their blood tests are normal, that they are not anemic, and that everything looks fine. But they still feel exhausted, weak, unfocused, or not like themselves. That's because iron deficiency doesn't always show up as severe anemia right away. In many cases, iron levels and hemoglobin appear normal, while iron stores are already depleted. During this stage, symptoms appear gradually and are often blamed on stress, poor sleep, hormones, or aging. In this video, you'll learn 10 clear and common symptoms of iron deficiency, how and why they develop, and why so many people live with them for years without realizing iron is the missing piece. Understanding these signs can completely change how you interpret fatigue, weakness, and low energy. Why iron is so important. Iron is essential for life. Its main role is to help produce hemoglobin, the protein in red blood cells that carries oxygen from the lungs to every tissue in the body. Without enough iron, oxygen delivery decreases energy production, drops muscles and organs work less efficiently, the brain receives less oxygen. Iron is also involved in mitochondrial energy production, immune function, neurotransmitter synthesis, temperature regulation. Because iron affects so many systems, deficiency can cause a wide range of symptoms. Many of them subtle at first. Now let's go through the symptoms one by one. Symptom 1. Persistent fatigue. That doesn't improve with rest. The most common symptom of iron deficiency is ongoing fatigue. This is not just feeling tired after a long day. It's a deep, persistent lack of energy that doesn't fully resolve with sleep. When iron is low, hemoglobin production decreases. With less hemoglobin, less oxygen reaches the tissues. Cells are forced to produce energy under low oxygen conditions, which is inefficient. This leads to constant tiredness, feeling drained early in the day, low stamina, reduced motivation. Many people adapt to this fatigue and assume it's normal. Over time, it becomes their baseline. Iron deficiency often causes shortness of breath, even during light activity. Walking upstairs, carrying groceries, or mild exercise may feel unusually difficult. This happens because the body tries to compensate for reduced oxygen delivery by increasing breathing rate. The lungs work harder to bring in oxygen, but without enough iron, that oxygen cannot be efficiently transported. This symptom is often mistaken for poor fitness, anxiety, or aging. The brain is extremely sensitive to oxygen levels. When iron is low and oxygen delivery is reduced, symptoms such as dizziness, lightheadedness, frequent headaches, difficulty standing up quickly can appear. These symptoms often worsen with dehydration, heat, or physical exertion. Many people experience these signs long before anemia is diagnosed. Iron deficiency reduces hemoglobin, which gives blood its red color. As hemoglobin drops, skin may appear paler than usual, especially in the face, lips, gums, inside the lower eyelids. This paleness is often subtle and easy to miss, but it reflects reduced oxygen-rich blood flow. Symptom 5. Cold hands and feet. Iron plays a role in temperature regulation. With reduced oxygen delivery, blood circulation to extremities decreases, leading to cold hands, cold feet, sensitivity to cold environments. This can happen even in warm conditions and is often chronic. Symptom 6. Hair thinning or excessive hair. Shedding hair follicles require oxygen and nutrients to maintain the growth cycle. When iron levels drop, hair follicles may shift prematurely into the shedding phase. This leads to increased hair loss, thinning hair, slower regrowth. Hair loss due to iron deficiency is often diffuse rather than patchy and may persist for months. Many people attribute this to stress or hormones, but iron deficiency is a common contributor, especially in women. Symptom 7. Brittle nails or nail changes. Iron deficiency affects tissues with high turnover, including nails. Common nail changes include brittle nails, ridges, spoon-shaped nails in more advanced cases. These signs reflect long-term iron depletion and reduced tissue oxygenation. Symptom 8. Restless legs or muscle discomfort. Iron is involved in dopamine production, a neurotransmitter that helps regulate movement. Low iron levels can disrupt this system, leading to restless legs, uncomfortable sensations in the legs' urge to move, especially at night. This symptom often interferes with sleep and worsens fatigue. Iron is essential for brain oxygenation and neurotransmitter function. When iron is low, people often experience difficulty concentrating, mental fatigue, slower thinking, memory issues. This is commonly described as brain fog. Many people assume this is stress-related, but iron deficiency is frequently involved. As iron levels drop, the heart compensates by pumping faster to deliver more oxygen. This can cause rapid heartbeat, palpitations, feeling your heart pounding. These symptoms often appear with exertion, but may occur at rest in more advanced deficiency. Iron deficiency develops for several reasons. One major cause is chronic blood loss, especially heavy or prolonged menstrual cycles, gastrointestinal bleeding, frequent blood donation. Another cause is poor absorption. Iron absorption can be impaired by low stomach acid, digestive inflammation, certain medications, gut infections. Diet also matters. Iron from animal sources is absorbed much more efficiently than iron from plant sources. In addition, foods like coffee, tea, calcium, and some grains can block iron absorption. Increased needs also play a role: pregnancy, growth, intense physical activity, chronic stress. And finally, chronic inflammation can trap iron in storage and make it unavailable for use, even when total iron appears normal. Why iron deficiency is often missed. Many people are told they don't have anemia, so iron deficiency is dismissed. But iron deficiency develops in stages. Iron stores, ferritin, drop first. Symptoms appear next. Anemia appears later. This means people can feel unwell for a long time before anemia is diagnosed. What to do? If these symptoms sound familiar, the solution is not guessing or blindly supplementing. Iron status should be evaluated properly, including ferritin, hemoglobin, iron markers in context. Correction involves addressing the cause of iron loss, improving absorption, choosing appropriate food sources, using supplementation when necessary, allowing time for recovery. Iron levels do not normalize overnight. Recovery takes weeks or months, but when iron status improves, symptoms often resolve gradually and consistently. Key takeaway: iron deficiency doesn't always scream. It whispers. Fatigue, weakness, hair loss, cold intolerance, brain fog, and shortness of breath are not just normal life. They are signals. Understanding these symptoms allows you to stop normalizing feeling unwell and start addressing the underlying cause. Because when iron status is restored, energy, focus, and physical resilience often return with it.